Hi, my name is Danny Hills. I'm a manager in the Research and Innovation team at the Australian Primary Healthcare Nurses Association, APNA, and an adjunct professor at Monash University and at Federation University. Healthcare systems worldwide are under pressure from rising costs, increasing demand, and the need to reduce environmental impacts. Indeed, responding to climate change is increasingly recognised as a healthcare priority. So sustainability is a critical concern for contemporary healthcare systems, encompassing care, safety and quality, economic efficiency, and environmental stewardship. The education and training of emerging and qualified clinicians and other health system staff is essential in ensuring the delivery of safe, high-quality care in an efficient, cost-effective, and environmentally sustainable manner. And of course, various educational approaches can be employed to foster healthcare sustainability, ensuring that professionals are well equipped to meet current and future challenges. Now, there are a number of key components to sustainable healthcare education and training. Four main ones. Firstly, environmental stewardship. This includes sustainable procurement, so understanding how to source medical and other supplies and equipment that are environmentally friendly and ethically produced. Energy efficiency, how to manage and reduce energy consumption in facilities, including using renewable energy sources. Effective utilisation, like reducing the use of unsustainable products and using products most effectively and efficiently. Then waste management, covering waste segregation, recycling and reduction techniques to minimise the environmental footprint. Secondly, economic sustainability is important, and the first key part of that is around workforce management, learning how to effectively recruit, develop and retain an appropriately educated, skilled and engaged workforce, one that is supported in working to their full scope of practice. Cost management, of course, is important, learning how to manage budgets effectively, reduce unnecessary expenses, and allocate resources efficiently. And then there's value-based care, emphasising the importance of outcomes-based healthcare, where the focus is on providing the best possible care at the lowest cost. Next, clinical practices. And it's important to emphasise prevention and early intervention. This is about the importance of measures to reduce the incidence or new cases of acute illness and chronic disease, to a lower long-term healthcare costs and resource use. And then there's evidence translation, fast-tracking evidence-based, cost-effective and less resource-intensive care models, interventions and technologies into practice, supported by continuous improvement efforts. And the fourth element is social responsibility, health equity, training on strategies to ensure all populations, regardless of socioeconomic status, have access to quality care, such as through the greater uptake of telehealth and other digital technologies. And then there's community engagement, encouraging healthcare professionals to work with communities to identify and co-design strategies to better address local health needs and disparities. So when we're thinking about strategies for implementing sustainable healthcare education and training, we would be thinking about all of the range of in-person or online, academic or workplace-based, hard copy or digital, and semester-based, modular or micro-learning approaches that would typically be considered today. There are probably 5 key components to think about. Curriculum development is the important one. Right up front, integrating sustainability concepts into medical, nursing and allied health curricula, focusing on practical applications within clinical settings. And interdisciplinary approaches, so encouraging collaboration across disciplines, including design professionals, to provide a holistic view of sustainable healthcare practices in preparation for the interdisciplinary work that they will experience on graduation. Continuing professional development is important. There needs to be a program of ongoing training programs for current healthcare workers on the latest sustainability practices and technologies, and leadership training, developing programs that prepare healthcare leaders to champion sustainability initiatives within their organisations. For both of those two parts above, you need to think about experiential learning, so real world scenarios, using exemplars and simulations to teach healthcare professionals how to apply theoretical knowledge and implement sustainable practices in real world scenarios. And of course, field-based training, providing opportunities for hands-on experience in sustainable healthcare environments, such as green hospitals or clinics. Research and innovation, of course, is important. We need to support sustainable research, encouraging research into sustainable healthcare practices and technology, and I might say appropriately funded as well. Another interesting approach might be to set up innovation hubs and partnerships, like establishing centres and collaborations that focus on developing, prototyping and testing sustainable healthcare solutions, including in relation to systems, processes and models that support safe, high-quality care. And the fifth part there is around policy and advocacy. So people need to understand about compliance and standards, understand regulations related to sustainability in healthcare, ensuring compliance and relevant integration such as with safety and quality standards, and promoting best practices. And then there is advocacy for change. This is skills development in engaging with policymakers, communicating effectively with stakeholders, as well as developing and advocating for policies and practices that support the implementation of sustainability and economic responsibility, locally, nationally, and globally. So in conclusion, education and training for healthcare sustainability is going to be essential if we are interested in creating resilient, efficient, and equitable healthcare systems. Educational approaches to healthcare sustainability are diverse and multifaceted, encompassing integrated curriculum development, continuing professional development, experiential learning, research and innovation, and policy and advocacy skills development. By integrating environmental, economic, workforce and social dimensions into healthcare education, we can prepare professionals to lead the way in sustainable practices. Investing in sustainable healthcare education and training will be a critical step towards building a healthier, more sustainable future.